Hi, I'm Dr. Paul. Welcome to Car Injury Care TV. It's the show where we answer the most common questions regarding automobile accidents, medical and legal. And what we're talking about, we're talking with Dr. Greg Hollstrom today. He's from a chiropractor from Largo, Florida, for the Florida Center for Back and Neck Pain. And we're specifically talking about, Dr. Hollstrom has a interesting certification and degree in chiropractic neurology, and so we're actually talking about how that particular degree helps patients who have been in automobile accidents. So, Dr. Greg, if you could explain what is a chiropractic neurology or certificate in chiropractic neurology?
The chiropractic profession has a degree of specialties just like the other medical specialties do. For example, radiologist or orthopedics, neurology, there's specialties in nutrition as well. My residency program was done in chiropractic neurology, and that is approximately a 3-year residency program. It involves additional specialized training involving injuries and diseases of the nervous system, which includes the brain, the spinal cord, the peripheral nerves.
And that's an extension of your chiropractic degree, right?
That's correct. That program is not initiated until someone has graduated from chiropractic school.
Okay, so you graduated from chiropractic school. Where'd you graduate from chiropractic school?
It's called the National College of Chiropractic. It's now known as the National University of Health Sciences.
Okay, and then after that you did your neurology education, is that right?
Shortly thereafter, yes, I did my neurology residency through a different college called Logan College, which is in St. Louis, Missouri.
Now, when you do a residency in neurology, what does that mean? What does that include? What do you do?
Well, some of the residency programs in chiropractic involve residency programs at medical facilities. This particular program was a postgraduate program where I could present to a location with an instructor with hours of lecture time and testing. There's a certain amount of hours that need to be completed and before a physician reaches the point where they become eligible for board examination.
And how many hours or years of additional education is that?
You know, I'd have to check the actual syllabus, but the completion of the program took me approximately 3 years.
Okay, okay. And how does that apply? How do you use that special so you're board certified chiropractic neurologist? By the way, there's probably not a lot of them, are there?
Well, I tell you, subspecialty in chiropractic medicine has become more commonplace, but compared to all chiropractors out there, doctors who have specialized in, for example, neurology, are probably in the minority.
Mm-hmm. Now, how can your extra education in the neurology field help your patients who are involved in automobile accident traumas of such?
Well, I think the greatest benefit is in the additional knowledge base, because by having an additional knowledge base, it increases the amount of things that are brought out in the patient's examination, from their history to their physical examination. There's a general rule in medicine that you won't find 100% of the things that you never look for. So by having this extra degree of information, not only are you able to find these things and document them, but it allows you to treat a larger variety of different types of problems in ways that some providers may miss.
Right. Now, I take it you can do other types of diagnostic tools with that certification, is that right?
Yes. I employ all the diagnostic testing that all physicians will use in evaluating a patient. But I also have additional certification in electrodiagnostic medicine.
Oh, okay, okay. So that's in addition to the neurology?
That is correct.
Okay, okay. So is it safe to say that if you can evaluate a patient a little more thoroughly neurologically and maybe not have to refer them out to a neurologist, is that a safe statement?
That would be a safe statement, but a lot of times if diagnoses are in question or if I want additional opinions, sometimes I will refer to medical neurologists just for under the philosophy that sometimes two heads are better than one.
Right.
So that doesn't exclude a medical neurological referral, but a lot of times they complement each other.
Mm-hmm. And what would you say the primary benefit for the patient would be to seeing a board-certified chiropractic neurologist versus just a regular chiropractor?
Well, I think probably the greatest benefit is in, number one, the physical examination and the documentation of their neurological problems, but also in the development of a therapy plan based on what is found in the physical examination and the diagnostic testing. So there will be different types of therapy that may be employed that otherwise would not be employed with a doctor who hasn't had the neurological background.
Would it also be safe to say that you maybe see more patients with nerve damage related injuries and automobile accidents than maybe the average chiropractor? Would that be a safe statement?
I would say that would be a safe statement, and I would also add that I would probably be, I am aware of these patients when they come in and therefore know what to do with them from day one.
Right, right, okay. And as far as treatment, what would you say the primary benefit to the patient would be seeing a board-certified neurologist, a chiropractic neurologist, from a treatment perspective?
Well, when you see a chiropractic neurologist with someone who has nerve-related injury or a disease process, well, the chiropractic neurologists are kind of a functional medicine group, meaning that in the medical community, many of the neurologists provide an awful lot of diagnosis, but oftentimes not a lot of treatment. And the chiropractic neurologists utilize the body's joints and muscles and what's the sensory nervous system to help nerve-related injuries based on the interrelationship of the neurological inputs involving the spinal cord, the brain, and the peripheral nerves.
I would assume, and I don't know this, help me out here, but is it, you probably get more complicated cases, I would imagine, referred more complicated cases from maybe attorneys or other medical doctors, wouldn't you?
Yes, we do. We enjoy a nice referral pool from a lot of the medical community, and oftentimes we will see patients that have neuromuscular types of problems involving peripheral nerve entrapments, auto trauma involving nerve injury. Sometimes we'll see stroke patients or concussion patients, and are working with these people in addition to other medical providers in trying to bring them to a resolution and maximum medical improvement.
Good, okay, very good. All right, well that was very informative. This is Dr. Paul again with Car Injury Care TV, and we're talking again with Dr. Greg Hollstrom at the Florida Center for Back and Neck Pain here in Largo, Florida. And for more information, you can look Dr. Greg up, Dr. Greg Hollstrom here in Largo, Florida. All right, this is Dr. Paul. We'll see you the next time. You take care. Bye.